I did my Theorist project on Dr. Patricia Brenner. She was the founder of the theory From Novice to Expert. Patricia Brenner was born in August 1942 in Hampton, Virginia. She became a nurse in 1964. She had earned her Bachelor's of Arts degree in nursing from Pasadena College in 1964. She was given a Master's of Science in Med-Surgical Nursing from the University of California at San Francisco in 1970. And she received her PhD in nursing from the University of California at Berkeley in 1982. Some quick facts about her. She's a researcher and lecturer on health, stress and coping, and skill and ethics. She was elected as an honorary fellow of the Royal College of Nursing. She was a staff nurse in med-surgical, ER nursing, coronary care, intensive care units, and home care. Her most recent research is the study of nursing practice in ICUs and nursing ethics. So Brenner's theory has 5 steps to becoming an expert nurse. The first step is novice, the second is advanced beginner, the third is competent, and the fourth is proficient, and the fifth is expert. Brenner believed nurses expanded their knowledge from experience in the clinical setting, making them a competent nurse. That just kind of shows the ladder to get from novice to expert. So a novice nurse is someone that has no background. They have difficulty deciding between relevant and irrelevant aspects of a situation. Usually includes nursing students, new nurses, and a nurse-changing area of practice. An advanced beginner nurse is someone who demonstrates acceptable performance, having experience with enough real situations. Still at times requires experienced nurses to assist them. These nurses are guided by rules and task completion. Competent nurses have 2 to 3 years of practice in the same area of nursing. They begin to realize patterns and realize what is important and what is not. Proficient nurses have 3 to 5 years experience in the same area of nursing. This nurse perceives information as a whole, qualitative leap beyond the competent nurse. An expert nurse is someone that has 5 years or greater in the same area of nursing. This nurse no longer relies on a rule or guideline to connect his or her understanding of the situation. They operate from an understanding of the total situation. How is nursing conceptualized in Brenner's theory? This theory was used as a tool for looking at the competencies of nurses and the effectiveness of training. The theory changed the profession from depending on research and now relying on more experience in the clinical setting of the experienced working nurses. Is Brenner's theory being used today? Well, in our class it is, nursing school curriculum. I found an example that it was also being used at Highland Hospital in Rochester, New York. I found that this theory was important to me because being fresh of orientation as a new nurse is definitely overwhelming. Not knowing every question, every answer, having questions for our coworkers is a lot during your shift. After learning about this theory, it makes me feel better when asking questions because it's kind of expected being a novice nurse to have questions. Why did Brenner develop this theory? She developed this theory because she believed a nurse develops skills and understanding of patient care over time from educational background and clinical experiences. And these are my references.